A new study highlights more disparities in healthcare and the importance of the kind of care babies receive right after they are born. It found that Black newborns are more likely to die during their initial stay in the hospital than white newborns, but it also shows a Black baby would have a higher chance of survival if they have a Black doctor. Jennifer Bellamy has more on the research.
A study published in the Proceedings of the National Academy of Sciences found that in the United States, Black newborns die at a rate that's 3 times that of white newborns. But when Black doctors care for Black newborns, their rate of death was cut in half. The study looked at 1.8 million hospital births in Florida from 1992 to 2015. It found the biggest drop in Black newborn deaths came among complex births and at hospitals that deliver more Black babies. Researchers say the race of the doctor looking after white babies didn't make much difference in their chances for survival. A USA Today review of the study says it didn't give an exact reason for why this happens, but it did identify some structural issues that may be factors. One theory suggests Black women may be less healthy and thus at a greater risk for negative outcomes as a result of the combined effects of racism and socioeconomic disadvantages over the course of their lives. That included limited access to health care and education, factors that also put Blacks at a greater risk for contracting COVID-19. Another similar issue is the high rate of maternal mortality for mothers of color. Last year, the CDC said Black, American Indian, and Alaska Native women were 2 to 3 times more likely to die from pregnancy-related causes than white women.
Researchers say the new findings don't mean only Black physicians should care for Black patients, but it does show that all doctors need better training on how to treat patients of color, and there is a need for far more diversity within the medical field.